I'm Nakeisha Neal Jones, Executive Director of Black Women Thriving East of the River. We are a radically inclusive organization that's focused on reducing cancer mortality and increasing health-related workforce success. We do this by ensuring that women who are most impacted really have a voice in how the programs get designed and how they get carried out. Our work specifically with the Health Equity Fund is focused on employer best practices. We all know that trainees can get better, women in our community can get better through training and through getting education and certifications. Yet there are some strategies that are necessary for employers to adapt for everyone to be more successful. So we're working with employers to identify and highlight best practices for attracting, retaining, and helping Black women advance in health-related careers. A very simple but huge piece of our work, again, is centering lived experience. There are so many programs that exist that don't actually talk to the people who are going to be using the work. And so my biggest hope is that let's always talk to people that we think will ultimately benefit from our programs to inform the way that we do it, and listen. Listening means not just that we hear them on that day, but listening means that their thoughts, their experiences, their realities, the resources that they need are really reflected in whatever strategies, whatever programs, whatever resources are being committed to the communities that we're trying to serve.
My name is Lienna Feleke-Eshete. I use she, her pronouns, and I'm the Senior Manager of Policy at Whitman-Walker Institute. Whitman-Walker Institute is the sibling organization to Whitman-Walker Health, which is what most people think of when they think of Whitman-Walker. And we do policy, research, and education work to advance the mission of Whitman-Walker Health. We work on federal issues, state issues, and then of course local issues, with this project being one of our local projects. First job out of college was working in the Senator of Maryland's office, and that was during the change of administration, and I realized that I could not do the work that I wanted to do if the policies that were coming down from the current president were going to continue to be in place. So I started doing policy advocacy work, first in the reproductive health space and then now in health equity. Health Equity Fund focuses on two areas. One is the development of a partnership framework, so that will bring together partners who do work across issue areas in DC and figure out, in terms of partnership, what's working well and what is not working well, and then how we can codify what is working well so that we can kind of work more seamlessly together, break down the silos that exist, and be more equitable in our partnerships. And then the second part of the project is focused on the creation of a queer and trans agenda for racial and economic justice that will mirror the mayor's racial equity plan with more of a focus on queer and trans communities here in DC.
My name is Audrey Lyon. I'm the Executive Director of Yachad, which is a Hebrew word that means together. And first I want to thank you for inviting me to speak today. Thank the Community Foundation of Greater Washington for inviting me to speak today. The question is, why am I doing this work? A person's home is the foundation of everything that they do. Where you live does matter. And for the past 30 years, I've been involved with Yachad to see that lower income homeowners in the DC area have a safe and decent place to live. And what keeps me in this work is as the communities change, families should be able to stay in their homes and gain benefit from where they're living in safe and functional places, and also build equity in their homes as neighborhoods are gentrifying. People don't want to leave their homes to go someplace else, to go to a bigger house, a better house, a new neighborhood. Families have put down roots in communities, are entitled to stay there. and gain the benefit of when neighborhoods are being reinvested in. So Yachad's work is important to support both long-term homeowners in DC neighborhoods, as well as a lot of new homeowners who are able to now buy their homes as a result of various city programs and other opportunities, but maybe need additional resources as they continue to live in their home. So our work has been very exciting because it's changed over the years as DC has changed. Well, my lifetime is living in DC, and what I want our community to know is that people in our neighborhoods' voices matter and their concerns matter, and the issues that they're facing every day on the ground are things that we need to address and address now. And part of that begins with nonprofits being able to be heard and to work with our city agencies, local and federal, to make sure that the resources are spent in the neighborhoods and not on more policy papers and on research papers and pilot projects. We have the answers to what can happen, and we have to make it real now. And that's what DC residents deserve. And that's what keeps me in this work for so long, because I've seen what needs to be done, and now our voices need to be heard.